Good afternoon, everyone. Thank you for joining us here today for this usual media conference to update on the situation with COVID-19. I'm joined today by the Chief Constable and also by the National Clinical Director, who will both say a few words shortly. But I want to start with an update on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, I can report that there have now been 5,275 positive cases confirmed, which is an increase of 318 from the figures reported yesterday. And as I always am at this stage, let me be very clear that these numbers are an underestimate. A total of 1,832 patients are currently in hospital with confirmed or suspected COVID-19. That is an increase of 51 from yesterday. And a total of 207 people last night were in intensive care with confirmed or suspected COVID-19. That is actually a decrease of 5 from yesterday, though I would caution against reading too much into that at this stage. And it is with great sadness that I must report an additional 48 deaths of patients who had tested positive for COVID-19. That takes the total number of deaths of individuals who had tested positive in Scotland to 495. And I want, as usual, to reflect on the fact that as I report statistics, each and every one of these statistics represents a human being, somebody who was loved and who leaves behind grieving friends and relatives. And I want today to extend my deepest condolences again to everyone who has lost a loved one to this virus. And I also want, once again, to thank, from the bottom of my heart, all of those working in our health and care sector. At 8 o'clock last night, people across Scotland yet again demonstrated our appreciation for the incredible work that you are doing. All of us owe you an enormous debt of gratitude. There are a few things I want to briefly update on today. Firstly, an update on the meeting of COBRA that took place yesterday. Following that meeting, the position and the advice from all 4 governments across the UK is unchanged. Scotland, like the rest of the UK, will remain in lockdown through the Easter weekend and into next week. At the moment, we simply do not have enough evidence on the impact of the restrictions to have confidence yet about when we could start to come out of them. As that evidence becomes available, we will be able to review the situation, but for now, the message remains exactly the same as it has been. People need to stay at home. I know how difficult that is, and I know how difficult that will be, particularly over this Easter weekend. Ordinarily, that is a time to see friends and family. It's a time to get out and about or even take a short break. None of that will be possible this year. And so for all of us, I know that this weekend will be especially tough. However, I am confident, very confident, that the vast majority of people across Scotland will continue to comply with these rules. As I said at the outset, I'm joined by the Chief Constable today, who will say a little bit more shortly about how these measures are being enforced. And his presence here today also gives me the opportunity to thank and pay tribute to our police officers for the difficult job that they are doing extremely well right now. But from the data, we know that travel in Scotland has now been reduced almost entirely to that which is essential. So I want to also take this opportunity to thank all of you for your patience and compliance and for the sacrifices that I know all of you are making. And I think it is important as we head into this weekend to reiterate what the rules are. Other than for a few very specific reasons, people should not be going out. You should not be meeting up with people from other households. You should observe social distancing measures when it is essential for you to go out. And if you or other people in your household are showing any symptoms of COVID-19, remember, a fever or a persistent cough, you should be isolating completely. For the Easter weekend especially, it's worth stressing that nobody should be travelling for holidays in rural or island communities. These areas may be less populous, but they are also especially vulnerable to the impact of this epidemic. Now, none of us, including me, want these restrictions to be in place for a single moment longer than they need to be. But I want to stress very clearly today what we cannot do. We cannot allow ourselves to become complacent against this virus. and end these measures prematurely. If we did that, we would risk undoing all of the work we've put in so far, and we would risk seeing the virus spread out of control, potentially very quickly, and we know that that would cost more lives. So all of us must continue to comply with the rules because that gives us our best chance of slowing the spread of the virus, protecting our National Health Service, and of course, saving lives. Now, I have three other brief items that I want to update on today. The first concerns the expansion of NHS capacity. Later today, I will visit the NHS Louisa Jordan Hospital at the SEC in Glasgow to see for myself the preparations that are underway and to thank those who are working so hard to make that new facility possible. And obviously, I want to stress during that visit, social distancing measures will be observed at all times. Over the past week, more than 20,000 square metres of flooring have been laid at the new facility. Partitions between beds have been erected and 8,000 pieces of medical equipment have been ordered. As a result, the NHS Louisa Jordan is on track to be operational by mid-April. The site will initially create capacity for 300 extra hospital beds with the ability to expand to over 1,000 if that is required. But again, let me be clear, our current hope, indeed our current expectation, is that this hospital will not need to be used. But it is important that we prepare now so that it is available if it is necessary. The second point I want to touch on is the economic impact of COVID-19. This morning, as I do every Friday morning, I chaired the Cabinet Subcommittee on the economy. We know how severe the economic impact of this crisis is and is going to be. And we know in turn that an economic crisis occasioned by a health crisis can lead to poverty, inequality and poor health. So I want to stress that the economic impact felt by many businesses across our country right now is and will be vital to our thinking as we plan our way forward in a way that protects human health as our key priority. The third and final update concerns the relaunch of our campaign to tackle domestic abuse. We know that anyone can be a victim of domestic abuse, but we also know that women and children in particular are vulnerable to it, and they will feel even more vulnerable during this crisis. That's why we've allocated additional funding to organisations like Scottish Women's Aid and Rape Crisis Scotland. The relaunch of the domestic abuse campaign is another important step. Amongst other things, it will highlight the different sources of help and support that are available to victims. And an important example of that is Scotland's Domestic Abuse and Forced Marriage Helpline. I want to be clear that that remains fully operational at all hours of the day and night, 24 hours during this pandemic. People can email or web chat through the website or can call them on 0800 027 1234. We know that there are some victims of domestic abuse that will be worried about bothering the police and other services during this crisis. This campaign makes it absolutely clear these services are open and they are there to help you. Do not hesitate to use them if you need them. And I also want to stress that our National Health Service is there to help you too. Other illnesses have not gone away because of COVID-19. So if you have chest pain or unusual bleeding, for example, it is important that you seek help. Contact your GP, or if it is out of hours, contact NHS 24. The NHS is open and you shouldn't hesitate to use its services. Let me close by reiterating my main message for today. That is about the importance of staying at home. I know it is tempting and will undoubtedly be tempting over this weekend to think that after almost 3 weeks of complying with these really tough restrictions, we can allow ourselves one little slip to see our friends or visit a grandparent on Easter Sunday. But the risks of that would be enormous, and they are not risks worth taking. The one time you ignore this guidance could be the time you get infected with the virus, or it could be the time that you pass it on to a loved one without knowing about it. So please do not throw away all of the good work of the past 3 weeks, and do not put yourself or your loved ones at risk. All of us must continue to do the right thing and follow the rules. Every day we do that does bring us a day closer to the ability to return to normality. So let me end by thanking everybody in advance for doing the right thing over this weekend. I hope you all stay safe and stay well. And I hope that in these most unusual of circumstances, you all have the best possible Easter weekend. Let me now hand over to the Chief Constable to add a few words.
Thank you, First Minister. Good afternoon. I am pleased to report that the vast majority of people in Scotland are, in fact, continuing to do the right thing during this acute health emergency, and I thank them for that. The social distancing legal requirement to stay home is the best way to protect the NHS and the best way to save lives. And of course, community policing across Scotland has a vital role to play as we all make the daily changes and personal sacrifices needed to combat the spread of coronavirus. With the continued support and cooperation of our fellow citizens, Police Scotland will explain the legal instructions, encourage compliance, and when needed, enforce the law. Since the emergency powers came into effect 2 weeks ago, we have been required to take enforcement action in limited situations. Thus far, across the whole of the country, we have issued over 500 fixed penalty notices. This has typically been during incidents where people do not comply with legal instructions, even after being spoken to by officers. For example, house parties or gatherings in public where those involved refuse to disperse. However, overall, compliance has been very high in Scotland, and I thank the public for their overwhelming cooperation and commitment. Our officers and staff are in communities right across Scotland 24 hours a day, at times putting themselves in harm's way, and I pay tribute to them and thank them for that. Social distancing, staying at home, are the key interventions to curtail the spread of coronavirus. Policing in Scotland will always seek to be fair, reasonable and proportionate. That is why I have invited a leading human rights lawyer to review our use of the emergency powers. I ask all our fellow citizens to continue their support and cooperation as demonstrated in recent weeks. Please, stay home, stay safe and follow the guidance. And underline the comments of the First Minister. Do not make personal exemptions bespoke to your own circumstances. If you are out and about, officers may ask you why. I would encourage you to engage with officers, explain your circumstances, then listen to and act upon any advice given. And as the First Minister outlined, of course we recognise this is an extremely difficult time, particularly during the Easter holiday period, when in normal circumstances we would all be expecting to be out and about, enjoying the good weather and seeing family and friends. But I ask that everyone accepts the changes to our daily lives and the personal sacrifices required, because ultimately it will be to the benefit of us all. If we all do the right thing to maintain social distancing, stay home and keep safe, we will protect the NHS. And if you need help and support from the police service, contact us. We are there to help you. Please, please, stick with it. Obey the law. Continue to play your part and lives will be saved. Thank you.
Thank you very much indeed, Chief Constable. I'm going to hand over now to Professor Jason Leach, who many of you will have become used to seeing on television, answering lots of questions and helping everybody to understand the situation. Jason is our National Clinical Director. I'm going to hand over to him to say a few words.
Thank you, First Minister. I'm going to simply emphasise two messages which you and the Chief Constable have already given. Message number one is stay the course and stay at home. You can leave home for the 4 reasons that you now know well. Can I just emphasise that exercise is exercise, not recreation, not your hobby. It's not the time to go mountain biking. You need to just use it for 30 up to 60 minutes from your home to exercise to stay healthy and then stay at home. So please do that, because every time you do it, literally lives are saved. My second message is similar to the Chief Constable's. The National Health Service is open. It is available. It is available from community pharmacy all the way up and including intensive care. Your GP practices, in fact, are open today and Monday, unusually, over this Easter weekend, as are your community pharmacies. Social workers are open and working. So the National Health Service is there for non-coronavirus disease and coronavirus disease. You already know, I think, to call 111 if you have deteriorating symptoms or you're struggling after 7 days of coronavirus symptoms. but your GP is available for other disease, other things you're worried about, perhaps for you or your children. So I want to really emphasise, particularly over Easter, stay at home, please stay at home. And the NHS is still there for you and ready to help you. First Minister.
Thank you very much indeed, Jason. I'm going to now take questions from the media. I will begin with Kay Nicholson from STV.
Chief Constable, would you be able to just give us a few more concrete examples of some of the issues your officers are facing on the ground? You mentioned house parties. Is there also cases of unessential travel, for example?
The nature of people's lives are such that, that there are many different circumstances that the police service has needed to make an intervention. We always start with a level of engagement, trying to educate people to comply with the guidance. But one specific example I could share is a house in the Scottish borders where a group of people had gone to spend some time. Police service went there late morning, told them they shouldn't have been there, gathering in clear breach of the guidance, and we left. However, they didn't comply. We were required to return a number of hours later. A number of the 5 were arrested. A number were issued with fixed penalties, and it made it quite clear that we will always seek to engage and educate, but if people continue to willfully refuse to obey the law, willfully refuse to play their part in combating the coronavirus, we will take action and we will enforce the law.
Thank you, Chief. And that underlines this point here. These powers that the police have for enforcement right now are not powers any of us would have envisaged a few weeks ago, but they are there for your protection. They're there for the protection of each and every one of us. And that's why we're asking people to obey these rules, but it is also why it is important that we have the ability to enforce them if people don't obey them, because by not obeying them, you are potentially putting people at risk. Next, Joe Pike from Sky.
Good afternoon. A question for each of you, if I may. Starting with the Chief Constable. Will Police Scotland patrol supermarket aisles to monitor what people are buying, as some English police forces have suggested? To Professor Leach, someone from Public Health England has talked today about possible partial measures to end the lockdown. Do you believe you have the power to lift some of these restrictions unilaterally, separate from the rest of the UK? And First Minister, your CMO resigned after visiting her second home. Should Community Secretary Robert Jenrick resign after making a series of trips between London and one of his homes 150 miles away in Herefordshire?
On that last question for me, I haven't had the opportunity to look at the detail of that, so I'm not going to comment without having done so. What I would say, and the incident you referred to here in Scotland at the weekend is an example of this. These rules apply to all of us, and we all have to comply with them. Obviously, people who are in key jobs doing essential work have to be at work, but even then, complying with these rules on social distancing is about the protection of all of us. So I would say that pretty clearly, even although I don't know the detail of the circumstances of the minister that you refer to. I'm going to hand over to Jason next, but can I say on the powers issue, because it's probably more one for me, it is for me as First Minister to take the action that I think is best and appropriate for the protection of public health in Scotland. That's the Scottish Government's task. Health is a devolved matter. But we are seeking, as we have been going into these lockdown measures, as we come out of them, we are seeking to have a UK-wide approach. Ideally, we would come out at the same time, but that will be very much driven by the science, and we've got to act in a way that allows us to do what's right for our different populations, and I will not hesitate on that if I think there is particular action required for Scotland. But the Four Nations discussions have been helpful, and I think we all want to see that Four Nations approach continue. Jason, do you want to say something more generally about the importance of these lockdown measures not being lifted prematurely?
Yeah, so I was going to say I don't have the power to decide, and the First Minister has just described who has the power to decide. I have the power to advise, and all of the UK-wide advisors are saying the same thing. We're saying it is too early to decide. It's hard It's really difficult, particularly over Easter weekend, but we are not in a position to advise the politicians of the 4 countries, and this happened yesterday in a COBRA meeting, to relax any of those measures yet. And when it is appropriate to advise that, we will. And then the decisions will be made by those senior politicians. There's certainly not any decision yet about what that will look like regionally or countrywide, and that will be a matter for the 3 First Ministers and the Prime Minister subsequently.
Thank you, Jason. Chief.
Policing in Scotland is absolutely founded on a very, very close relationship with the communities that we serve. Right from the outset, even before the regulations were actually enforced, I made it clear that I expected the people in Police Scotland to use common sense, to work with the communities that they are part of, work with the communities that they serve. I would not expect patrolling of supermarket aisles. I would expect our officers to be visible, to be engaged with people wherever they happen to be, but I would not expect such prescriptive action.
Thank you. David Henderson from BBC Scotland.
Thanks very much. I'd like to ask again about the breaches of the lockdown rules. First Minister, when we hear that police are still having to break up house parties, are you concerned that some people may already be tiring of these rules? And Chief Constable, you said your officers have now handed out more than 500 fines across Scotland. For that reason, can you clarify why the Chief Medical Officer was not fined? Are you really enforcing these rules in a fair and uniform way?
I'll hand over to Chief Constable to answer the question to him. Can I say my strong belief is that the vast majority of people in Scotland are understanding why these rules are in place and are complying with these rules. Where people are making mistakes, then they are sort of rectifying that, and that is appropriate. There will always be a minority of people who do not comply, and that's why, unfortunately, we need to have enforcement measures in place. But, while I understand there will be a focus on the number the Chief Constable has just given about fixed penalty notices, let's not forget that is a tiny minority when you compare that to the whole Scottish population that are doing the right thing for the right reasons. And that's why I want to continue to say a really heartfelt thank you to people, because I know how difficult this is. Of course, I worry about people tiring of this. I think we all find it more difficult to comply with these rules with every day that passes. And as I've said several times standing at this podium, that even in Scotland with Scottish weather will get more difficult as we go into spring and the weather gets better, the nights get lighter. Nobody is under any illusion about that, but that is why it remains important for me as First Minister, for the Chief Constable, for Jason, for all of us in government, to be very clear with people that we will not ask you to do this for a minute longer than we think it necessary. But right now we think it necessary and we think it vital. And if we stop this prematurely, this virus hasn't gone away, as we see from the figures, but if we stop these measures prematurely, this virus will start to spread out of control very quickly. That will very quickly overwhelm our National Health Service, and it will very quickly see the numbers of people who lose their lives from this virus, unfortunately, rise even beyond the horrible numbers that I'm having to stand here and report every day. So that is why we need to stick with this, and I really appeal to people to understand that and to comply with it. Chief Constable.
Thank you. I made it very clear from the outset that we would take enforcement action in regard to people where they refused to listen to the encouragement, they refused to recognise that their actions had been wrong, and they refused to rectify those actions. We will always start with seeking to explain why an individual or individuals are in breach of the regulations, and if they refuse to accept that, we will take enforcement action. Now, in regard to the previous Chief Medical Officer, I am very satisfied that that matter was dealt with in a timely, a fair and proportionate manner. Dr Calderwood accepted the error of her ways without any equivocation, and was very clear on that and accepted that she would change her behaviours. It was therefore entirely appropriate that a warning would be issued, and that's exactly how I would expect any citizen to be dealt with in the eyes of the law. It was dealt with fairly and it was dealt with in a timely manner that was entirely in accordance with how every other citizen would be dealt with.
Okay, thank you. Paul Smith from Central FM.
Thank you very much, First Minister. We have had home carers from Falkland Council come forward to us this week to say that there's still no social distancing in their office and that they're yet to receive sufficient PPE. How much of a concern is that to yourself?
Can I, Paul, actually, I missed the very start of your question about who you were talking about.
Sorry, yes. Carers from Falkland Council, home carers, come forward to us this week to say that there's still no social distancing in their office and that they've yet to receive sufficient PPE. How much of a concern is that to yourself?
Well, it is obviously a concern anytime I hear concerns from people who feel that they don't have PPE or they don't have correct social distancing, but it's not just something I'm going to express concern about. I will undertake to look into that as soon as we're finished this media conference, and if there is more advice or more practical support required, we will deliver it. In fact, I will here live on television ask Jason Leach to look into this immediately after the press conference.
Down home carers Falkirk.
Right, okay, so we will take that away as we will, and I would stress again, as I've done at this press conference before, there is the email hotline for anybody in a frontline position who feels they don't have the PPE they need or should have to get in touch directly, and that is overseen by ministers. Fraser Knight from Global.
Saying that they're facing a financial crisis because of the coronavirus. Yesterday, The Guardian reported that St Andrews University is facing a £25 million shortfall. I was just wondering what support the Scottish Government will be giving to universities to ensure that they can get through this in the same way that they're giving to businesses across the country.
Well, the scale of the financial challenge facing higher education is well understood by ministers. The Deputy First Minister, obviously the Education Secretary, has already been in dialogue with universities. We clearly want our universities to remain where they are right now, which is at the very forefront of global education, delivering the quality education and research that they are globally renowned for. So we will work closely with the sector to inform a package of support that could be forthcoming from the Scottish and UK governments, and we'll keep very close to them as we understand the scale and the nature of the challenge that we face. But it is one example of the deep impact in an economic and financial sense that I spoke about. I want to be very clear, this is a public health crisis, and as I've said before, the preservation of human life is our top priority. But clearly that public health crisis and the way we've dealt with it has also created an economic crisis. An economic crisis in turn can create issues with health and poverty and inequality. So these are issues that holistically are absolutely at the forefront of our thinking as we plan how we go from here to at whatever and as quick a stage as we can get the country back to normal. But the plight of our universities is something that has very active consideration by ministers. Tom Eden from PA.
Thank you, First Minister. Every day that passes, we see more examples of care home deaths, sort of big numbers in certain care homes. The Royal College of GPs and Care Scotland have today said that PPE availability has improved greatly since last week, which is obviously good news. But GPs are now not going to be visiting care homes unless there's a clinical need. I was just wondering if this is a concern and what more can be done to support care homes in this time.
The nature of what care homes do and the services they provide obviously make them places that we have to pay particular attention to. It's why at the very early phase of this crisis, specific guidance was issued to care homes to help them in an infection control sense deal with the challenge that they are facing. The Care Inspectorate is also very closely involved with care homes to make sure they've got the advice and support that they need. And as you say, we've been working really hard to address PPE issues, and we will continue to do that, although I do think we have and are well on the way to resolving the issues there. The final point I've made, I'm going to hand over to Jason, the National Clinical Director, to say a bit more about this, but people should get the care they need, the care that is appropriate for them and their condition. And I think that regardless of age, regardless of background, regardless of where in the country you are, the principle of our National Health Service is you get the care that is appropriate to your needs. And that is true of people in care homes just as it is for anybody else.
So there's been a lot in the media around the transformation of intensive care and the transformation of our hospitals and the Louisa Jordan. But actually, there's also been a transformation of the way we deliver care at home and in care homes and in social care. And it is to be acknowledged as much as that higher end care that we've all talked about. I need and hope that everybody within those care homes gets the care they need, of course in a different circumstance that we're all now facing. General practitioners are very, very well placed to make choices and decisions with families and residents about when they should visit, when it is safe to do so. And I am fully engaged with that process around what they can do and what they can't do. And they know how to do that. We had a call last night across the 4 UK countries quite late about the care home sector because all the countries in the UK are concerned that we provide the right support, the right guidance, the right PPE, but also the right care and compassion for the residents and the families that face this really difficult pandemic in a unique circumstance in our care homes. So we will continue that work every day.
Okay, thank you, Jason. Izzy Lyons from The Telegraph.
Hello. First Minister, you made some comments on social media this morning about universal basic income and how you think the case for it has been increased due to the pandemic. Is this something that you would like to see introduced in Scotland over the coming months? And have you made an approach to the UK government about getting the powers to do it?
We haven't made that approach yet. As I'm sure you understand, we are still absolutely immersed in dealing with the immediate impacts of this pandemic. I'd say 2 things. Firstly, we have been previously exploring the concept of a citizen's income, a universal basic income. I did in my programme for government, I think 3 years ago, indicate some pilot work that we would take forward with councils, which has been progressing. So it's a concept I've long been interested in, although haven't come to an absolutely definitive view in my mind about whether it's something that would be practical or indeed desirable to do. But I do think on this issue, as no doubt in so many issues, the current crisis we're facing and the fundamental impact that this crisis is having on how we live our lives, on the economy, on every aspect of what we have taken for granted, means that coming out of this, governments are going to have to do some big, bold thinking about how we recover from this and how we support people along the way. So my comment this morning is one that I absolutely feel very strongly about. Of course, there would still be a lot of detailed exploration and work to do around a universal basic income. But I do think, given the nature of what we're dealing with right now, that the case for that has been immeasurably strengthened. So it's something the Scottish Government will be keen to take forward. I don't mean a press conference like this to make a constitutional point, but it is a point of fact that because of the current powers of the Scottish Government, we would require the cooperation of the UK Government. But I hope it's a debate that we may be able to advance in the fullness of time across the whole of the UK, because people are being deeply hit and affected in a financial sense by this, and the simply tinkering with the status quo may not be enough to get us to a place of recovery as quickly as we want to do. Tom Peterkin from the P&J.
Good afternoon, First Minister. The road haulage industry has called for cash support, warning that it is close to collapse at the moment. I was just wondering if this is something the Scottish Government can specifically help with, and what measures are you putting in place to help the industry? Well,
we've put in place a number of measures to help the economy generally and particular sectors. We continue to have discussions. I've just spoken about the university sector. We continue to have discussions with a range of different sectors about the particular challenges they're facing and what government needs to do and might be able to do to help. And that will include the road haulage sector as well. So I'm not able to say, standing here right now, what that might look like, but we will continue to have those positive discussions. And I take very seriously, and I know the UK government does as well, the responsibility in a situation where we are asking people to do unprecedented things, which is then having an unprecedented impact on our economy, that the help that comes from government therefore must be unprecedented as well. So we'll continue to look closely at all of these things. And the final thing I would say is road hauliers are, one of the groups of workers right now that are helping to keep the country going, delivering essential food supplies, for example. So they're one of the groups of many, many groups that I want to take the opportunity to pay tribute to and say a heartfelt thank you to. Seth Carell from The Guardian.
Minister. Good morning, First Minister. Just on the question about the university's funding crisis, university principals are saying this morning that they need several things from the Scottish Government. They're after a guarantee that the Scottish Government would pass on full Barnett consequentials if there's any bailout from the UK Government for the sector. And they're also looking for a very particularly targeted funding package and changes from the Scottish Funding Council, including special money for research and also an increase in the teaching funding to deal with the shortfall in overseas students. Will the Scottish Government act on those requests?
As I have said, specifically in relation to universities, but more generally, we are in active discussions, and the Deputy First Minister has been and will continue to engage with the university sector. I'm not able, when we put together packages and we're able to announce those packages, we will do it, but there are some very complex discussions that we need to have. But all of these points, I know exactly what the universities have been asking for, and we'll continue to have that discussion. The one thing I will give a commitment to today is whatever Barnett consequentials come to Scotland through funding announcements for particular sectors or particular areas because of this, we will pass on those consequentials in full. That's a commitment we gave with the business support, and I would give that with universities as well. We haven't yet had any commitments to consequentials on that, I should add, but if and when we do, they will be passed on in full. Those requests over and above that are ones that we continue to discuss with universities and discuss them very sympathetically. Scott McNabb from The Scotsman.
Yeah, First Minister, we've had a confirmed prisoner death at Saughton in Edinburgh today. I'm wondering whether that's possibly leading you to consider invoking the emergency powers you have on releasing prisoners. And also for Professor Leach, on today's figures, I know we're saying it's too early to read too much into the data, but the increase on positive cases is down on yesterday's figure, and obviously talked about intensive care obviously being down, and the increase in deaths has obviously fallen as well from yesterday's figures. Is there some cause for encouragement that things are maybe flattening out?
I'll hand over to Jason in a second. Can I address the issue with the death of a prisoner? Firstly, let me say that we take the health and well-being of everybody in our prisons, whether that's prisoners, prison officers or our healthcare workers, extremely seriously. And the death of a prisoner in prison is always one that is a matter of great regret. It is also the case that when a prisoner dies in prison, there is an automatic referral to the Procurator Fiscal and a fatal accident inquiry. I think beyond that, I will not go into details any further than that, because obviously confidentiality applies in these cases as it would apply to any other individual. On the issue of prisoner release, we pay very close attention on a day-to-day basis, and the Justice Secretary and I discuss this regularly, to the overall size of the prison population, the impact that restrictions on the day-to-day regime of prisoners right now because of coronavirus are having. We look at the absence rate of prison officers, for example, and we will continue to make the judgments that we think are in the best interests of prisoners and those who care for prisoners. But we will always see prisoner release as a last resort. And I think people would expect us to do that. But of course, we have made sure that the powers are there if we think that is something that is required to keep our prisons safe places for prisoners and for those who work in them. But that would be something, of course, that would be reported to Parliament with appropriate scrutiny of that. Jason, sorry, I'll hand over to you on the...
So the basic answer is we don't have enough trained data to tell us whether what you say is right or wrong. So Patrick Vallance, in the English press conference yesterday, did talk about some of the leading indicators beginning to flatten off, but it's very, very early days. So we need more data points, is the slightly geeky way of putting it. We just need more data. And remember, the mortality data will be the lagging point. So today's mortality data, tragic mortality data, as it is every day, do not expect that to continue to fall quickly.
And the point, just to finish this point, because I think it's really important that we are very clear with people. We all want to get to a stage where we have evidence that these measures are working to suppress the virus. That's the whole point of them, and we will look very carefully at the case numbers, the hospitalisation numbers, the ICU numbers, the death numbers, and as we get that evidence, we can inform our future strategy. But again, not to depress people, but to be in the interest of being candid with people. That does not automatically mean we can just lift everything again, because in the nature of a virus like this, we've got to be careful that having suppressed it, we don't do things that just allow it immediately to get out of control again. These are horrendously difficult judgments and complex judgments that we will make in the period ahead, but protecting people from the impact of this virus will remain absolutely central to them. Rachel Watson from the Mail.
First Minister, you briefly mentioned business support there. We've heard from a number of extremely concerned business owners in the past few days about the differences in the business support grants available to the rest of the UK. One firm has told us that it could stop trading after 125 years, with 131 jobs to be lost in the process, because they're only entitled to one grant of £25,000 despite having multiple properties that would be eligible south of the border. Will the Scottish Government look at this again, and will you work with businesses to see what further support can be offered?
We will continue to keep all of these things under review. We will continue to work with businesses. I mentioned earlier I've had today the meeting of the Scottish Cabinet Subcommittee on the Economy, where support for businesses was, as it always is, one of the areas of discussion. We are passing on every penny of the consequential funding that has come for business support to businesses. We have tried to make sure that that helps as many businesses as possible. So because of some of the decisions we have taken, there are some businesses with a rateable value at a certain level that will get support in Scotland that they wouldn't get elsewhere in the UK. That's a decision that we've made. We've also been able to give support to particular sectors that isn't available in other parts of the UK. To the seafood sector, for example, we've given help to the bus industry. We've given help with water charges to businesses. So we're trying to make sure that this funding, welcome funding, helps as many businesses as possible. But of course, we will continue to listen. We will continue to seek to help businesses to the maximum possible. And those conversations and discussions are ongoing. Mark McLaughlin from The Times.
The people that I speak to fall into two camps. The first camp is, we just want simple messages, don't confuse us with ifs, buts and maybes. But the other camp in the wider science community are saying we need more information about our exit strategy. I'm just off the phone with Linda Ball. She's a behavioural scientist whose colleagues at the Usher Institute are on your advisory group. And she said to me, the public need to know what the strategy is going to be for releasing the lockdown. What is the plan? There's a national debate happening in Denmark, Austria, Germany. I don't hear the Scottish Government talking about this. The main reason, from a behavioural science perspective, that we need to hear those soon is to give the public hope that there is a next stage. Still quoting Linda, I'm not a virologist. I'm a scientist and I'm a researcher. And in terms of democracy, we need transparency and we need to see that information. She also warned, or she also feared that the additional deaths that we saw on Wednesday was signs of the lockdown actually being deleterious to health. So do we understand any more about these additional deaths we saw on Wednesday? And to answer Linda's question, what is the plan?
Well, let me try and take that bit by bit, Mark, and Jason may want to add something here. Firstly, I'm not able to say more about the excess mortality that was reported for the most recent week on Wednesday, which appeared to suggest a level of mortality over and above previous weeks, the similar week in previous years. And not all of that could be accounted for by COVID or by the registration anomaly that we spoke about on Wednesday. But that is something that is being explored. And as Gregor Smith said the other day, this is a phenomenon that is being seen in other countries right now as well. So I think there will be some global discussions there about some of what's at play here. I would say two things. I hope I've demonstrated this rather than just said it. I'm a great believer in times like these, although none of us have lived through times like these before, in transparency. I'm, as First Minister, asking people to do really, really difficult things, and therefore I have to be able to stand up here and explain why I'm asking you to do these things and explain the basis for that. So I will continue to try to be as open and transparent as possible. Different countries are at different stages in the curve, so the debate in some countries might be a bit more advanced than it is here. But for me to stand up here today and say, here's the exit strategy, I would not be acting responsibly, because I don't have the data and the evidence or the advice yet that would allow me to say with confidence we can come out of where we are now by doing X, Y and Z in this particular order, and be confident that wouldn't have disastrous effects in terms of the virus spreading. I hope to be standing here in the not too distant future in a different position, where I can say, okay, the advice and the evidence and the data is now telling me this, so here is what we're doing. Because nobody, believe me, it's possibly not the case that nobody wants this more than me, everybody wants this, but I want us to be out of this situation as quickly as possible. But I don't want to allow, on my part or on the public's part, impatience to get out of this, to actually do more damage than good, and to do the damage that we've been trying to prevent. So we will continue. We're having lots of discussions and thinking hard and looking at the evidence as it gathers. The SAGE UK-wide advisory committee will have further discussions next week. Later next week there is likely to be another COBRA meeting to start looking at this. But we've got to get the timing of this right, because the consequences of not would be absolutely devastating. But my final point is every action has a reaction. Everything you do to try to deal with one thing has consequences elsewhere. And I am acutely mindful of the consequences of the lockdown in a whole range of ways. And that has to be part of our thinking. So I'm not trying to get sympathy here. These are horrendously difficult challenges for everybody who is advising governments and for governments everywhere. But I will continue to try to reach with due process the right discussions, and in the meantime give as much clarity as I possibly can to the public about what we're asking them to do now and why we're asking you to do it, because it's by complying with these rules now that we do give ourselves the best chance of getting out of this quicker and not at a later stage having to go back into it. So please keep doing what we're asking you to do. Jason, do you want to add anything to that? Sorry.
Only that. I think there's a slight misunderstanding in some circles about the peak. The peak is not a sharp point. It won't be on a Tuesday. It will be a curve. It will be over time. So we will not know what that peak looks like and what the curve looks like for some time. And then the advice will change. And then the decision makers will choose what we do on that downward curve. We're trying to balance three things now and on the way out. We're trying to balance harm from the coronavirus, harm if the health service gets overwhelmed, and harm from the lockdown. These three harms are all mixed together, and so the judgments are really challenging, both for the advisors and for the decision makers. And that's what we're trying to do. So just now, the priority is to suppress the virus, because we're trying to reduce harm number one the most, because that's the most acute challenge right now. That will change over time, but there will still be consequences to everything that we choose to do.
Okay, David Ball from the Herald.
Thank you, First Minister. A couple of weeks ago, you announced you were setting up a Scottish advisory group to work alongside SAGE. Are we able to get an update on any sort of Scottish-specific analysis and virus modelling, and how that may have differed from the rest of the UK, and when that work is likely to be made public?
Well, we will again be transparent around that and make sure that the outputs of that are able to be scrutinised, just as is the case with SAGE publishing its minutes. That group is still at a reasonably early stage. I met with Professor Andrew Morris, who is the chair of that group, just yesterday. But as the SAGE evidence emerges, then the role of that group is to make sure that is understood in a Scottish context. So it's a really important group for me to have as First Minister, and as it advises me, we will continue to be transparent about what the impact of that is on our decision making. And lastly, Alistair Clark from Edinburgh Live.
Thanks, First Minister. You'll be aware of the tragic deaths in Scottish care homes that have been linked to coronavirus, including at facilities in Edinburgh and the Trinent Care Home in East Lothian. Agency workers are obviously a vital part of the care workforce, while regular staff are self-isolating. but we've heard reports of agency workers moving between facilities which have an outbreak and which don't have an outbreak, potentially spreading the virus to vulnerable residents while inadvertently whilst asymptomatic. Care sources have told us that the only way to stop that is for an expansion in testing for those workers. So can I ask you what support the government is giving to the care sector specifically with regards to that?
Well, the government is trying to do everything we can to support the care sector, and that will continue. The Care Inspectorate has a particularly important role here to engage directly with care homes to make sure that guidance has been followed and any particular support they need is provided. And I will certainly convey the terms of that question to the Care Inspectorate so that they can make sure it's something that they are looking at. We are increasing testing capacity every day. That will allow us to test more health and care workers, and I've said previously, and it's worth repeating today, that care workers are amongst the priority group that we want to be tested, and we've reminded health boards of that. But as we increase testing capacity, we'll see more key workers be tested. But the final point I'd make here, again, it's one I've made before, but it's just to give a bit of context to this. It's not me saying testing is not important. It is important. It will be very important in an eventual exit strategy. But the test we have right now, the diagnostic antigen test that we use right now, can only tell whether somebody's got the virus when they are symptomatic. It can't tell if somebody's got the virus when they're in the incubation period, nor can it tell that you've had the virus once you're clear of symptoms. So it is only when you are symptomatic. And I would say that anybody who is symptomatic, whether they are a care worker or anybody else, should be isolating at home. You shouldn't be at work if you are symptomatic, because the guidance is for you to isolate for 7 days and for your family members to isolate, your household members rather, to isolate for 14 days. Jason, do you want to briefly say anything else about the care home sector?
I think you covered it. We're trying to do all we possibly can for care homes, from PPE all the way through to the guidance. And what you describe is perhaps an information challenge about social distancing and hand washing. We haven't talked much about hand washing. The key public health intervention, remember, is still hand washing, because it breaks the cycle of the virus. All the other things we're doing about self-isolation and staying at home also break the cycle of the virus. But the key advice for all workers, everywhere, care homes and hospitals, is hand washing is the most important thing they can possibly do. And we will, of course, get them the PPE they require and the guidance they require and perhaps the education they require.
Okay, thanks, Jason. We've completed all the questions we had notified from journalists. I'm going to ask the Chief Constable just to say a final word or two before I wrap this session up.
Thank you, First Minister. I want to close with a couple of brief remarks, really just to reiterate the fact that the National Health Service is at a time of absolute acute demand. All of us in Scottish Life want to do what we can to help the National Health Service. And the one thing that we can do is to follow the guidance and obey the law. That's what we can do to protect the National Health Service. The police service in this country is utterly founded on the citizens that we serve. We get our authority and our legitimacy from them. I know this is a really, really difficult time, but everybody in policing is there to help people in the country. Everybody in policing is there to make sure all of us do the right thing. We need to help the National Health Service, and the way to do that is by following the guidance. Do what's been asked of you, and we will save lives.
Thank you very much, Chief Constable. Gives me an opportunity at the end again to place on record my thanks to our police officers, the length and breadth of the country, who are doing an even tougher job than normal at this time, but doing it as they always do exceptionally well. Thank you to Jason Leach for joining us today as well. I hope you're still finding these briefings useful. We are hopefully over the next couple of weeks going to be able to stand here and give more information about where we think we are with this virus and what we think the future looks like. I want to stress again, none of us want these measures to be in place for a single minute longer than they have to be, but right now they do need to be in place. So I ask you again over this Easter weekend and as we come out of it to please abide by the stay-at-home message, because you are protecting yourself and your loved ones, you're protecting our National Health Service, and you're helping us to save lives. Please have a good Easter weekend, notwithstanding all of the unusual circumstances we live in just now. The weekend briefing on Sunday will be led by the Cabinet Secretary for Health, Jean Freeman. My team has prevailed upon me to work from home this weekend, so we'll see how that goes. And I will see you again on Monday. Thank you very much indeed.